Dear friends, greetings to all of you. Today, our topic of discussion is thrush, that very same condition that affects many women, and surprisingly, even men. It may seem like a trivial and annoying problem, but thrush, despite the plethora of medications advertised on television, often does not go away with just one pill. Many people turn to the internet seeking help, expressing their frustration with recurring thrush that won't go away no matter what they try. This raises a valid question: why, despite all the advancements in medicine and the wide range of advertised tablets, creams, and suppositories that claim to cure thrush in just one day, does thrush persist for many individuals, both women and men? Is the advertising misleading? Well, it's not entirely false, but it's not the whole truth either. Approximately 50% of individuals find relief from thrush with tablets, creams, and suppositories, while the other 50% do not experience the same success, or the relief is only temporary. So, why is it that these seemingly potent medications cannot completely eliminate this persistent condition? The truth is that thrush is caused by a fungus called Candida, which resides in the bodies of most individuals, including healthy women. The presence of Candida in small amounts is normal. However, thrush occurs when this fungus starts to multiply too actively for various reasons. But before we delve into the reasons behind Candida overgrowth, let's first shed light on the symptoms of thrush. Not everyone is aware of how it manifests. An experienced doctor will explain the symptoms of this condition, as they can vary. In women, the main symptom is specific discharge from the vagina, which appears like curdled white cheese. In men, it can present as red spots or irritation on the head of the penis. Other symptoms may include pain during sexual intercourse, discomfort, and burning during urination. These symptoms often lead to the misperception of thrush as a urinary tract infection, resulting in the prescription of antibiotics, which further exacerbates the thrush symptoms. Many people, following advice from friends or self-diagnosis, tend to consume antibiotics excessively, thinking it will help. However, excessive antibiotic use actually worsens thrush and can lead to its development. It's essential to limit antibiotic use to prescribed amounts by specialists. Of course, it's best to avoid them altogether unless absolutely necessary. I encountered the impossibility of having a private conversation as I was told that treating thrush is a very ungrateful task. Why is that? Well, it is indeed an ungrateful task because one of the reasons is improper and unbalanced nutrition. For example, a patient receives treatment recommendations and dietary advice, but then they indulge in eating sweets, pastries, and drinking alcohol, including beer. These actions essentially raise blood sugar levels. Regarding intimate hygiene, it is important to wash more frequently, but excessive cleanliness can also lead to the development of thrush. Some individuals have a habit of excessive washing, up to 3 to 4 times a day or after every restroom visit. This is something that should be avoided since it washes away the vaginal flora, leading to the growth of the Candida fungus. Furthermore, wearing synthetic and tight-fitting underwear can also contribute to the development of thrush. Therefore, during the treatment period, it is recommended to wear less attractive but more comfortable and breathable cotton underwear. As for sanitary pads, it is important to change them every 3 hours during the day to avoid creating a greenhouse effect that promotes the growth of Candida and other microbes. In cases where some women cannot go without sanitary pads, they can replace them with natural cotton cloths. Lastly, it is worth mentioning that stress and nervousness can also contribute to the development of thrush. When individuals are under stress, stress hormones are produced, which can intensify the growth of Candida. I will talk about the fact that many women experience the proliferation of Candida, leading to the development of thrush. This occurs because husbands insist on having sex, while women may not be ready to participate due to various reasons. However, not wanting to lose their husbands or for other reasons, they are forced to engage in non-intimate sexual acts. This can result in insufficient lubrication, leading to friction and the development of thrush. What can be done in such cases where desires and needs do not match? Firstly, it is important to have open communication and negotiate on what, where, and how much can be done. Additionally, women can explore alternative ways to please their partners or focus on developing their own sensuality through exercises. Furthermore, there are practical recommendations for treatment. For example, instead of expensive medications, it is recommended to use affordable and effective options like sodium borate. For women, this can be done by moistening a cotton tampon in a borate and glycerin solution and inserting it overnight. Men can simply apply the solution to the head of the penis. The treatment course consists of only 5 sessions. It is important to note, dear women, that this treatment with borate and glycerin should not be done during menstruation. Other treatment methods that can be used include lemon juice diluted in water for vaginal douching, drinking baking soda dissolved in water. Cranberry leaf infusion, cranberry juice, and chamomile can also be helpful. These are the same herbs recommended for treating cystitis. Lastly, it is crucial to mention that for successful treatment of thrush, all our recommendations should be followed, and if thrush persists alongside other hidden or undiagnosed infections, it is necessary to undergo testing for chlamydia, gonorrhea, and trichomoniasis. Thank you for this interesting conversation, and we bid farewell. Stay healthy and subscribe to our channel for more content. Take care.